Hello, I'm Tuffrey-Wijne. I am the chair of the Palliative Care for People with Learning Disabilities Network. This network aims to raise awareness of the palliative care needs of people with learning disabilities or intellectual disabilities, as it's known outside the UK, and to share and promote best practice. And I want to talk to you today about the impact of coronavirus on the work and the mission of the PCPLD network. People with learning disabilities are likely to be disproportionately affected by the coronavirus. Last year, about 4 out of 10 people with learning disabilities who died of respiratory conditions, and people with learning disabilities are much more likely to have underlying health conditions, so they are more vulnerable really to the impact of coronavirus. And coping with illness and dying and death and bereavement at a time of social isolation, it's hard, almost impossibly difficult to think about for all of us, but it's particularly difficult if you have difficulty understanding what's happening and why. And it is even harder if you depend on familiar people and familiar routines to get you through the day, and particularly to help you cope at difficult times. So there's a lot to think about. If you work in learning disability services or you're a family carer, then you will need support really in helping people with learning disabilities to understand what's happening, to cope with everything. You may have staff shortages, that's really very challenging, and you may need to be prepared to be involved in quite difficult decisions around what is best for people who get ill with coronavirus, whether they should stay at home, whether they should go to hospital and be on their own, stay at home and be supported by somebody that they know. These are difficult things to think about. And if you're a clinician working in another field and you may not have had much contact with people with learning disabilities, then you are more likely to see people with learning disabilities now. So you too will need support to manage this. People that you see, your patients are likely not to have somebody with them that knows them and that can help and support them. So lots of things to think about. I've been really heartened by the way in which organisations and people from all areas, professionals, clinicians, academics, carers, have come together to produce guidance and resources. It includes people with learning disabilities talking to each other on video, helping each other. Lots of guidance and resources out there and published really quickly. It's very impressive, including easy read materials. So we have started to gather some of those together on our website. There are other places where they're gathered. I'm sure you've all found them, but we have also put some of the links on our website. Here is the address, so do go and have a look, www.pcpld.org. And we also really are interested in hearing your stories, whether they're difficult stories, whether they're inspirational, things that you've done, things that didn't go well, disastrous, heartbreaking stories. We want to learn from each other and hear what's happening. So my email address is on the front page of the website. Please email me with your stories and let's share them. I'm afraid this is as high tech as you're going to get. We're all working from home. I don't have a printer here, so it has to be like this. This banner I still had lying up in the attic. It was waiting for our next conference, which is planned in Cardiff in September 2020. We have decided to postpone that, so this can go back up the attic in a minute. We're going to have it in a year's time now, a year later. It'll be September 2021. Just so that we all have the energy now to cope with this crisis, and we will have the energy when it comes to the conference to really share and learn from each other. And we've also decided to postpone our annual Linda McInhill Award, which was due to be awarded this year, 2020. That's now also going to happen in 2021. I hope you keep well, everyone. Look after yourselves, look after each other, and in particularly do support people with learning disabilities as best you can. I'm sure you are. Thank you.